Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about sciatic nerve gliding or nerve mobility as a way to help relieve nerve irritation and nerve pain. Hey everyone, so today we're talking about nerve glides or nerve flossing or nerve mobility. It goes by different names, these exercises, but essentially what you're doing is with all of your nerves, they are like pieces of string and they run throughout your legs and your arms and the rest of your body, between muscles, between connective tissue, between tendons and ligaments and everything else, bones, everything else that's within your leg. The nerve actually kind of weaves its way between all of those tissues. Now what can happen sometimes is these nerves can lose their mobility, so they're not moving as well, and we want them to be able to kind of floss and glide and move when your body moves. So if you straighten your leg, the nerve moves with it. If you bend your leg, the nerve moves with it appropriately. And to do so, it kind of has to move like a piece of floss between your teeth, just like going between the muscles. What can happen is the nerve can lose some of this mobility just due to muscle tension, due to connective tissue, due to scar tissue, whatever it may be, and the mobility of the nerve is not as good, and it becomes irritated and can be one of the contributing factors to nerve pain and discomfort. So one of the exercises that we like to incorporate with someone who is experiencing nerve pain, particularly if it's a sciatica type of pain, is nerve flossing or nerve gliding. So basically what we're doing is we're tensioning the nerve on one end, just like a piece of string, and releasing the tension on the other end. And we're going to alternate doing this, and what's going to happen is this flossing motion of the nerve, which is going to break up some of those adhesions and hopefully improve the mobility of the nerve, desensitize it, and help manage your pain effectively. So let me show you a couple ways to do that. So first way is laying on your back. And these are all for the sciatic nerve that runs from your low back, originates in the low back, and runs down your leg to your foot and toes. So what you're going to do is you're going to bring your leg up to about a 90-degree position, and you're going to hug behind the leg. And there's a couple ways to do it, so I'll show you both of them. One way is you're just going to extend your knee about as far as you can up, and then back off just a little bit so it's not all the way straight, but just a little lower than what your max is. And then all you're going to do is alternate between bending your ankle, bringing your toes toward your head, and then bending it away. So you're just going to nice and slowly, you only want to do maybe 10 or 12 repetitions at a time, bending the ankle back and forth. That's one way to do it. Another way is you can actually alternate between straightening and bending the knee and the ankle at the same time. So how you would do this is as you come up, you want to point the toes away, and then as you come down, point the toes toward your head. So up, toes away, down, toward the head. And this is trying to, again, loosen one part, but tighten the other side, and get that flossing motion of the nerve. Another way you can do this is through a straight leg raise. So a traditional straight leg raise is you're just going up and down like this. With this straight leg raise, we want to incorporate the ankle motions again so we can get that flossing motion of the nerve. So when you come up, you actually want to point the toes down, and then when you come down, point the toes toward the head. And up and down. It's good to do it this way. If you do it the alternate way, where you raise the leg and bend the toes toward the head, that's like you're going to give the nerve the max amount of tension. So it's like you're pulling it straight on both ends, and that can be a little more intense and can irritate the nerve and cause some pain and discomfort. So again, you want to alternate those movements. So toes pointing down when you come up, toes pointing toward the head when you come down. And then the other way. Just with the knee bent. Toes pointing down as you come up, toward the head as you come down. Or you can just hold it there and go up and down. There's also a way to do this in a seated position, and I'll show you that next. So now I'm going to show you how to do sciatic nerve glides in a seated position. You want to have a surface where your feet are going to actually hang off. You don't want your feet on the ground because that's going to make it more difficult. And basically we're just utilizing a seated knee extension motion, but we're going to incorporate some movements with both the ankle and at the trunk, at your head and your neck, because what we're going to do again is we want to focus on the two ends of the nerve. So we're tensioning one end and we're loosening the other end, alternating it to make that flossing motion. So for the maximal amount of tension through the sciatic nerve, you would straighten the leg, you would bend the toes toward your head, you would actually slouch down in bad posture, and you would flex your neck. This is the most tension, where you're pulling that nerve as tight as it can go and stretching it as tight as you can. We don't want to do that because that can be aggravating, especially early on. So we want to alternate the motions. So what you're going to do is, as you come up, you can point the toes toward the head, but you want to stay seated up and extend the head. And then as you come down, point the toes away, and you're actually going to slouch down and flex. So you come up, bend the toes, extend the head, and as you come down, everything goes the opposite direction and slouches. This is probably one of the few times where you actually are going to encourage that slouched position, flexed posture, because that's going to help with the nerve mobility. Again, you want to focus on just a few repetitions at a time, maybe do 10, a set of 10 or so. It can be aggravating for some folks, so you really don't want to overdo it, especially early on. Again, as you come up, you extend the head, bend the toes toward you. As you go down, push the toes down, and flex everything. So a relatively easy exercise, easy mobility movement to do. It does take a little bit of mental gymnastics just to get the sequencing down between your head and your ankle. It's kind of the pat your head and rub your belly at the same time, but with a little practice, you can get it down pretty easy. And again, just doing maybe one set of 10 repetitions and building up slowly over time so we don't aggravate things, improving the mobility of that nerve, and hoping to manage and decrease your nerve pain. Thank you.